Diagnose with Paul Rosen.
Our diets, our Western diets in America are just really, you just don't realize how poor they really are.
What would you say to others who would like to feel better?
Sometimes you need to find the instruction. That's where the testing and everything comes in, because without that knowledge, there's no way I could have got to the point where I'm at today.
Straight talk about health.
And then I start preaching and telling them what I've been doing. And this guy named Paul Rosen has changed my life.
With your host, Paul Rosen.
By the way, the information contained in this program is not approved by the FDA, nor intended to treat, diagnose, or claim to cure any medical condition or disease as defined by Western medicine. However, skilled practitioners of many disciplines have found nutrition response testing to be a highly reliable supportive technology for assessing the health and fitness of the body's functional system.
Susan, good morning.
Hello. Good morning.
Are you comfortable?
I am.
Excellent.
I guess so.
Excellent. It's just you and me talking, just like we were in the treatment room. It's very simple stuff.
Okay.
Really
Yeah.
simple stuff. I mean, the first question that I really always ask is, how did you come to see me in the first place?
Well, I had been listening to your radio show every Sunday, and I've listened to it for like 3 years, and then I actually started not feeling well about a year and a half ago, and I decided, well, boy, I better go see if I can get some help.
What were you concerned about? What were all of the things that you were experiencing that caused you to finally come and get evaluated?
Well, I was pretty much of a mess. I had extreme fatigue.
Say again?
I had to quit my job. I had to go to just part-time work.
Oh, my
I couldn't
gosh.
even make it through a whole day. I had anxiety really bad and panic attacks. I was having a pain in my stomach. I had heart palpitations. I could not lay on my left side at night without feeling like I was having some kind of heart issue going on. Pain and just crazy stuff.
Wow.
I had a ringing in my ears, joint stiffness, constant sinus problems, that was kind of a mess, and sneezing. And anyway, yeah, I was not feeling well at all. I was really worried.
And that happened about a year and a half before you came?
Yes.
So how did you address these things before you came to see me?
I went to my medical doctor, and they started giving me tests for trying to figure out what was wrong. I had, ultrasounds in my stomach, and I wore a heart monitor for 3 weeks, and they did every blood test they could figure out, and they all came back normal. There was nothing, they couldn't find anything wrong with me.
There was nothing wrong with you. Ha ha.
Nothing.
I mean, it doesn't sound like that's true.
I looked at that doctor, and I said, but I'm sick. I don't feel good. And they just went,
And that was it. That's
anyway.
And did they offer any medications or any, any other kind of therapy at that point?
Yeah, they offered me something to just like, no, not too much. They couldn't find anything wrong with me, really. Did offer me some kind of drugs, but I didn't want to take any drugs.
No, I
didn't want to.
Yeah, I understand.
But here's the funny thing.
Yeah.
After they took so many blood tests for me that they actually made me anemic, and they did give me iron pills because I had become anemic from all the blood tests they took.
Oh my God.
Isn't that crazy?
That is crazy, and I don't think I don't remember you telling me that, but I'm sure you did.
Yeah, well, that was the last time I went there. When the doctor says, "Well, your iron stores are low," and I said, "Well, could it be that I had 9 blood tests in the last 3 months?" And he says, "Oh, wow, no more for you."
Yeah. Did they offer you an antidepressant or an anti-anxiety drug?
Yes, they did.
Of course.
I'd have to take it for a month for it to become effective and then take it every day. And I don't want to take any medicine, so that wasn't going to work.
Well, usually that is really often the case when it comes to situations like yours, and many people experience this when all of the tests come back, as yours did, which appear to be normal, and yet you have all of these symptoms. The immediate go-to is you must be depressed.
Yeah, well, that didn't seem right to me.
So you had all these things, and you went through all these tests, and things came back normal. And what was it about what you were hearing from me that caused you then to reach out and take a step a little bit, I'm as I recall, a little bit out of your comfort zone?
Well, because you kept telling us that our diet and the food that we eat was so important, and that there was hope to change your life and to feel better. And I just had, I was kind of like, didn't have any other choice, and I thought, I know this is going to work, has to. Something has to work. So
you came and you got the evaluation using the muscle testing, and that was kind of unusual, wasn't it?
Yeah, it was really amazing, very interesting.
And then I gave you your personalized nutritional healing program based on the results, the nutritional deficiencies that we found, and the environmental impingements or barriers that we found. And you agreed to follow the program to the letter, did you not?
Yes, I did.
And
absolutely.
How long did it take you before you started to experience some improvement?
Just about probably 2 weeks. I started noticing my symptoms were lessening, and I could lay on my left side without having heart palpitations. I was just not having anxiety as much. And definitely after a month, the fatigue was going down. I just started feeling better right away.
So it took you a month, and then after, say, 3 months, where were you relative to, at that time, following your nutritional healing program? Where were you in your own sort of, subjective state relative to where you were when you started?
I was pretty happy because, you know what? All these symptoms that I had were gone. They were just gone. And I'm like, oh my gosh, this is so great. I had a twisted sore knee that I'd had for 4 years and had to wear a knee wrap to just walk around. And after about a month and a half of following your plan, my knee hasn't hurt since. It's not swollen. I don't have to wear that knee wrap anymore. It never hurts. It's that's the proof of it all.
Well, we call that we call that side effects in our particular game.
Yeah. Plus, I lost 10 pounds too.
Oh my gosh, you lost weight too? Another side effect.
Yeah, not even trying.
And of course, the most important thing is that you're continuing to do it, aren't you?
Absolutely. Nothing is worth going back. And all I did was change the way and what I ate.
And you also took some targeted supplements as well.
Right. Yes, the supplements are very helpful.
Yeah.
Yeah, and it's a huge difference, and I wouldn't go back to the other way for anything.
You and me both. We're simpatico there. I mean, who wants to go back to, feeling like you'd like to escape this particular life?
No, I'm happy. I have a lot of energy. I'm working full time again, and I just can't believe that it turned out so great. I mean, when you start feeling bad, you think, well, I'm just getting old, and this is what's going to happen, but it's not.
Now you know better, don't you?
That's right.
Yeah.
Yes.
Yeah. So what are
Yeah.
is that what are the biggest surprises since you began your program?
Just the way that I feel so much better. You know, it's when you have your health, that's the best thing in the world, you know. I have energy all day long. I don't know, I guess. And I'd like other people. I see a lot of people that don't feel well, and I'd like them to go and get checked out too. Because
now you and I both know that you can feel better even though you're getting older.
Yes.
Oh my gosh.
Right.
What? What?
That's right. It's not hopeless. There's hope. You can always feel better.
Yeah. I mean, you know, it's hard to put a price tag, on all of this. And as you know, I had my own sort of call to action and to restore my own health, and had to take control by stepping outside of my comfort zone, just like you stepped outside of your comfort zone, and
right.
and took the program that you got and didn't resist, didn't moan, didn't whine. You just went and you did it.
Right, I did. And, the first couple of weeks, it was kind of hard when I walked through the grocery store, and I couldn't even walk down the bread row because I kind of, I wanted to eat bread really bad, or grains. And I'd have to say nope and just keep walking, and
yeah, and
I remember.
Go ahead. Yeah, go ahead.
Oh, I just remember standing in my kitchen the first week, looking around, going, "What am I going to eat?"
Exactly.
Exactly. I got it. Yeah, I'm going to have to change. So I got out the list that you gave me, and I went to the grocery store and I just started buying a lot of things off the list, the vegetables and stuff, and not keeping bread in the house and no jelly, and
Yeah, for you
anyway,
personally, the bread and the sugar was really an issue.
Yes.
Yeah.
Even though I didn't eat a lot of it, but I did eat bread probably throughout the day, sandwiches and stuff.
Yeah, and everybody's different, right? I mean, what you're doing for you is not necessarily precisely what someone else would need to do in order to get the same kind of results. But I mean, if I said to you, well, you're feeling good now, that's probably everything's good, you can go back to doing what you were doing, what would you say to that?
No. No, because I just don't want to take a chance, and I'm a lot healthier and I feel so much better right now. It's not worth it. I've eaten a piece of chocolate cake in the past. I know what it tastes like. I don't need that. That's just me, though,
Well, but it's you. It's a new you.
Right. And it's such a privilege to know how to do this and to know that our bodies respond this way. To me, it's amazing knowledge and a privilege to be under your,
Oh, that's awfully kind. But remember, I had somebody who taught me too, so.
Right.
Yeah.
Well, when I was 19, I got asthma, and I did go to a naturopath a long time ago, and they cured me too. So I've kind of always had a belief in
alternative approaches. Yeah.
Yes.
Yeah. So you did mention some things with respect to how your life has changed since you started to do this. I mean, number one, you could actually go back and work full time. What's that worth?
A lot. Peace of mind, financial freedom.
Exactly. Yeah.
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 Yeah, I can keep up with my young daughters now, and for a year I couldn't even go out and do social things because I'd be too tired.
Have they noticed the change in you? Has anybody else noticed the change in you?
Oh, yeah. Oh, yes, they certainly have.
What do they say? I'm just curious.
Well, they're just really happy, and my youngest daughter, who's 22, she's just amazed. Wow, Mom, that's so great. And yeah, they're really happy, and they just knew that I would be better, I don't know. My other daughter that's 30, she's kind of into nutrition things too, so she already knows that makes a big difference.
Cool. Well, it sounds like you raised them right.
I hope so.
Well, it sounds like it. I mean, it sounds like you at least taught them that there is an option. You can go one way, you can go another way.
Right.
And that's pretty important. That's pretty important. So what would you recommend? Right. What would you recommend to anyone that you cared about or that was in trouble with respect to their health? Or, I mean, what would you say to them? I would tell them to come and see you and get evaluated and figure out a program that would work for them, because it will help them. That's what I've told people, that any people that I see that are kind of, suffering and sick, taking a lot of medicine and stuff, there is another way they can get better. And yeah, they should come see you. It's really amazing, and I'm so thankful.